Welcome to Physiopedia. Thank you for choosing Physiopedia to answer your question. Physiopedia is a wiki created for rehabilitation professionals, but we may also provide information that will help you to answer your questions. However, it is important to note that Physiopedia does not provide a medical diagnosis, and you should always consult with a medical professional when attempting to diagnose and treat a condition. So let us guide you through how best to use our pages. If you're on the Physiopedia homepage, you can type your keywords into the search bar here. You will then be taken to the page that you are looking for. You can also do a search if you're already on a Physiopedia page. You use the magnifying glass here, which brings up the search bar, and you can type in your keywords. Depending on the nature of your question, different sections of this page may be of more interest to you. The first section of the page will either be a definition or description, which provides a brief summary of the topic or condition. The other sections may vary depending on which page you are on and will discuss different aspects of management. They might include signs and symptoms, other conditions that are similar, management such as surgery, medication, diet, and of course physiotherapy management. The physiotherapy management section may cover topics such as exercises and other types of evidence-based interventions. To easily navigate to the different sections on a page, you can click on the Contents tab in the bar at the top of the page here. This will bring up a list of sections. You can click on one that may hold the answer to your question. Remember that professional opinion should be sought before self-prescribing any of these interventions to ensure that they are right for you and take into account your personal needs and any other medical conditions that you may have.